How a minor scrape led to a young boy's death. The tragic case of Rory Staunton, a minor scrape on the arm during a routine school gym class. A simple injury that seemed harmless at first glance. But for Rory Staunton, this seemingly insignificant event marked the beginning of a tragic cascade of medical missteps that would lead to a devastating outcome. How could a small wound on his arm escalate into a life-threatening condition? And why were the critical signs missed by those entrusted with his care? Rory Staunton was a lively and ambitious 12-year-old boy from Queens, New York. He was the eldest child of Orleth and Kieran Staunton and had a younger sister named Kathleen. Known for his infectious enthusiasm, Rory had a deep passion for flying, inspired by the story of Captain Chesley "Sully" Sullenberger, who famously landed a disabled jet on the Hudson River in 2009. This admiration for Sully and the world of aviation fueled Rory's dream of becoming a pilot, reflecting his interest in adventure, problem-solving, and his desire to make a difference. Beyond his love for aviation, Rory was an active student at the Garden School in Queens. He captained his school's debating team, showcasing his leadership skills and ability to think critically and articulate his thoughts effectively. Rory was also known for his strong sense of justice and empathy, leading a campaign to end the use of derogatory language at his school, which earned him praise from organizations like the Special Olympics. In addition to academics and advocacy, Rory was a bright, curious, and energetic child who loved spending time with family and friends. He was involved in various extracurricular activities, enjoyed sports, and was known in his community for his kindness and ability to bring people together. Rory's vibrant personality and genuine care for others made him cherished by his peers and teachers. But Rory's life took a tragic turn on March 28, 2012, during a routine gym class at his school. That day, Rory was diving for a ball in the school gymnasium when he sustained a minor scrape on his arm. This seemingly insignificant injury would become the starting point of a catastrophic medical oversight. Rory's gym teacher, addressing the wound in a rather cursory manner, applied 2 Band-Aids and sent Rory back to class without referring him to the school nurse or properly cleaning the wound. However, that same night, Rory awoke from sleep with severe pain in his leg and was noticeably uncomfortable. His parents, Orleth and Kieran Staunton, initially tried to soothe him back to sleep, thinking it might be a temporary ailment. The following morning, Rory Staunton's condition took a dramatic turn for the worse. What began as a minor scrape had quickly escalated into something far more severe. Rory awoke feeling unwell, with a high fever spiking to 104 degrees Fahrenheit. Alongside the fever, he experienced relentless vomiting and complained of severe pain in his leg. These symptoms were not just alarming. They were indicative of a potentially serious underlying issue. Deeply concerned by the rapid deterioration in their son's health, Orleth and Kieran Staunton decided to seek medical attention immediately. They brought Rory to his pediatrician, describing his symptoms in detail and emphasizing the scrape on his arm. The Stauntons were understandably anxious, as their son's condition seemed to be worsening by the hour. During the pediatric visit, Rory presented multiple symptoms that should have raised red flags. Mottled skin, a symptom that can indicate poor circulation or blood infection, severe leg pain, and stomach tenderness, suggesting a possible systemic infection. Despite these clear warning signs, the pediatrician diagnosed Rory with a viral stomach flu, a common ailment circulating in New York at the time. This diagnosis was a critical oversight. The pediatrician did not conduct further investigations or consider the possibility of a bacterial infection, which could have explained the severity and sudden onset of Rory's symptoms. The pediatrician advised Rory's parents to take him to the hospital for rehydration, assuring them that the viral illness would run its course and that there was no immediate cause for alarm. Trusting the pediatrician's expertise, the Stauntons took Rory to the emergency department at NYU Langone Medical Center, hoping for some relief for their son. At the emergency department, the medical staff continued under the assumption that Rory was suffering from a viral infection. Their primary focus was on treating his dehydration and nausea, symptoms consistent with the flu. Intravenous fluids were administered to rehydrate Rory, and blood tests were conducted to assess his condition further. However, a significant failure occurred. The results of the blood tests, which indicated severe abnormalities suggestive of a serious bacterial infection, were not promptly reviewed or communicated to the attending doctors. As a result, Rory was sent home without addressing the underlying infection that was rapidly worsening in his body. The Stauntons left the hospital, reassured but still concerned, unaware of the grave danger their son was in. As Rory Staunton returned home from the hospital, the Staunton family hoped the pediatrician's reassurances and the emergency room visit would bring some relief to their son. However, Rory's condition continued to deteriorate rapidly. He was unable to leave the couch, crippled by an unrelenting high fever and excruciating pain. His energy was drained, and he became increasingly lethargic, unable to eat or move comfortably. Orlith and Kieran Staunton, acutely aware of Rory's worsening state, were in a state of constant vigilance. They observed that his fever remained alarmingly high, and that his symptoms showed no signs of improvement despite the rehydration and medications he had received at the hospital. Rory's discomfort and persistent symptoms painted a picture far more severe than a typical viral infection. Throughout the day following Rory's discharge, his parents maintained continuous communication with his pediatrician, expressing their growing alarm. They described Rory's symptoms in detail, emphasizing the severity of his pain and fever, as well as the new symptoms of lethargy and lack of appetite. Despite these repeated and urgent calls, the pediatrician remained firm in her initial diagnosis, insisting that Rory was suffering from a common viral infection circulating at the time. The pediatrician reassured the Stauntons that viral infections often take time to resolve and advised them to continue managing Rory's symptoms with rest, fluids, and fever-reducing medications. Unfortunately, this reassurance, intended to provide comfort, delayed further investigation into the possibility of a more serious underlying condition. Rory's condition reached a critical point. On the evening of March 30th, he was in severe pain, and his fever could not be controlled with medication. Realizing the gravity of the situation, the Stauntons decided to take Rory back to the emergency room at NYU Langone Medical Center. Upon Rory's arrival at the hospital, the situation took a dramatic turn. This time, the urgency was apparent, and Rory was immediately admitted to the intensive care unit, ICU. It was here that the devastating truth emerged, a shocking twist that revealed the catastrophic oversight. Rory was in septic shock. Septic shock is a critical condition that occurs when a severe infection spreads throughout the body, causing a systemic inflammatory response. The bacteria had infiltrated Rory's bloodstream through the seemingly innocuous scrape on his arm, triggering a cascade of immune responses that overwhelmed his body. The realization hit like a thunderbolt. All along, Rory's escalating symptoms had been signals of sepsis, a condition that requires swift and decisive medical intervention. Yet these signals were tragically missed, overlooked in the rush to attribute his condition to a simple virus. In the ICU, the medical team fought valiantly to stabilize Rory, employing aggressive treatments and interventions. However, the infection had progressed too far. Rory's body was too ravaged by the undetected sepsis to respond to treatment effectively. Within 48 hours of his admission to the ICU, Rory succumbed to the infection. He passed away on April 1st, 2012, leaving his family devastated and struggling to comprehend how a simple scrape could lead to such a tragic outcome. The Stauntons were left grappling with the painful realization that their son's death was not only tragic, but could have been avoided with proper diagnosis and timely intervention. Hence, they embarked on a mission to raise awareness about sepsis and improve medical practices to prevent such failures in diagnosis and treatment. Recognizing the need for systemic change, the Stauntons established the Rory Staunton Foundation for Sepsis Prevention. The foundation's primary goal was to educate both the public and medical professionals about the early signs and symptoms of sepsis, a silent killer that often masquerades as more benign illnesses. The foundation quickly became a catalyst for legislative change. In January 2013, New York State enacted Rory's regulations, a set of protocols requiring hospitals to implement best practices for the early identification and treatment of sepsis. These regulations mandate that hospitals adopt specific procedures for pediatric patients, ensuring critical test results are communicated effectively and promptly. Rory's regulations marked a significant step forward in sepsis care, setting a precedent for other states to follow. By implementing these protocols, New York State aimed to drastically reduce the number of sepsis-related deaths, particularly among children. Beyond the legislative arena, the Rory Staunton Foundation actively engaged in public education campaigns. The Stauntons dedicated themselves to spreading awareness about the dangers of sepsis and the importance of early detection. They shared Rory's story widely, using media platforms to reach parents, healthcare providers, and policymakers. Their advocacy efforts extended to the national stage. In September 2014, the Stauntons organized the first ever sepsis forum in Washington, D.C., bringing together healthcare leaders, policymakers, and sepsis survivors to discuss strategies for combating this deadly condition. Their work highlighted the need for nationwide adoption of sepsis protocols and greater public understanding of the condition. Through the Rory Staunton Foundation, Rory's legacy lives on, driving continuous efforts to improve sepsis care and prevent unnecessary deaths.